Hi, welcome to my channel Nursing Medici. Today I came with the part 3 section of Aptitude stations in Ireland. So let's see the stations. So this is the remaining questions. I hope you have seen part 1 and part 2. So this is the continuation of the part 2. So let's see the videos. So once again, welcome to my channel Nursing Medici with Sharanya Sajid. So we'll continue the part 3, that is the 14th station. Here, the technical skill fluid administration via peripheral IV cannula. So here they are going to check how you are doing IV cannulation, but in the station they won't let you to put the cannula, but they are asking you to assess the cannulation site. So how you are going to assess the peripheral cannula site, and if you find something wrong, how you are changing that dressing, that's what they are going to check. So this is the way you're assessing. See if there is, it's healthy, IV site is healthy, we are giving 0, there is no phlebitis. If any pain or redness means we have to observe, that means possible sign of phlebitis. Like that, there is a score, you can read this chart. This is the way you have to assess IV, peripheral IV cannulation. So once you find, maybe you got the score 4, that means you have to resite the cannula. In that case, you have to change the cannula. Next is the technical skill of fluid administration via peripheral IV cannula. So in that also, they are not assessing your cannulation. Here, how you are putting the fluid. So when you're putting the fluid, you have to recheck is that the proper fluid. Then you have to check the expiration date and how you are preparing the fluid. These all things they will check. Next is the scenario of 75-year-old man for discharge home. So in this case, one person is discharging from your hospital to the home. So in that time, how you are communicating with that patient, as well as how you are giving in handover to your in charge. Clinical nurse manager means you're just like you're in charge. So how you are giving the handover, that's what they are going to check in that station. Next is the technical skill medication management. So for the medication management, technical skill is nothing but when you are giving medication, you have to record that, isn't it? How you are recording the medication administration. So maybe they will ask you to find an error in the medication administration, like maybe there won't be name, or proper dose won't be there, or frequency won't be there, or sign won't be there. So you have to find out that. Then next is a scenario of elderly lady who has not received her meal and relative is angry. So some, for many reason, maybe sometimes you cannot give at correct time. So if we are not giving food at correct time, of course the relative will be angry. So in that situation, you have to communicate and apologize with the resident and crisis management. Okay, next is the scenario of potential complications of bed rest teaching student nurse. This is a station you have to teach a student nurse. Here, what is a complication of bed rest? Of course, the chest infection. So you have to teach the prevention of chest infection, and there's a chance of pressure ulcer. So prevention of pressure ulcer also you have to teach to the student nurse. Then next is a station scenario, how to secure and check the position of NG tube, nasogastric tube. That also one of the station for teaching the student nurse. So you have to teach about the NG tube and how you are putting that one, and all those things regarding the procedure and assessment you have to teach. That's all about all the most of the stations questions. Okay, you will get only 14 stations, but here I have given 20 or 23, no, 20 I think. Yeah, I have given 23. That doesn't mean that you will get more station. I gave like same the student education, teaching education of the nurse itself, I have give 2 questions. So I just give the possible questions and scenarios you may get these questions. So best of luck, try all this and practice and read. So in this part 1, part 2 and part 3, I have explained nearly 23 or 24 stations. These all are the examples of scenario. So you are going to get such kind of questions in the practical exam. So if you are going through this video, you will get an idea how to appear in the practical test of this aptitude. And in my next video, I'm going to explain which all are the topics you have to read for the theory and practical. So they have mentioned those things in the RCSA website. If you want, you can read that or you can follow my videos. Thank you for watching. So don't forget to subscribe my channel. And if you like, you can comment and like and share my video.